Good morning, everyone. Welcome to this webinar. My name is Joan Hughes and I am the President of COTA New South Wales. This is a topic that we all need to talk about, death and dying, and it's part of Dying to Know Week, and that's why we're holding this webinar. I'm coming to you from my TV room in Sydney, and of course everyone knows that we've been locked down for about 8 weeks, I think it is, and it continues to be so. And in this room, just behind me, that you probably can't see, I have photos of all the people in my family that I've loved and lost. And some people in my family have a bit of a joke and say it's Joan's, it's the dead people in Joan's family. But more importantly, it's people that I can look at each day, and I have lots of memories about each and every one of them. This is an important discussion, especially as we manage the COVID world. For me, I've been thinking a lot about mortality, and I feel very sad that I have not been able to attend the funerals of 3 of my close friends. Having discussions about what is a meaningful death with key people in your life are very important. So we're pleased that so many of you, can join us right around New South Wales this morning. Before we get started with the discussion and to hear from our panellists, I would like to acknowledge all the First Nations people in New South Wales who are the traditional custodians of this land. I pay my respects to elders past, present and emerging, and extend that respect to other First Nations people who are present today in this webinar. You know, we can learn a lot about how First Nations people deal with death and dying. Funerals and mourning are very much a communal activity for First Nations people. So for those of you who don't know much about COTA, we are the peak body, and it stands for Council on the Ageing, so the peak organisation for people over 50 in New South Wales. As a policy and advocacy organisation, we work with politicians, policymakers, service providers and the media to make sure that the views of older people are heard and acted on. We also provide services for older people, so please check out our website for the details of these services. Now, I guess many of you have had some experience with some form of like Zoom or Teams, because this is our life at the moment. So I just want to go through a little bit of the Zoom housekeeping so that everyone can be clear about what we are supposed to do. Each of the presenters are, except for the presenters, all of you are on mute. You can't actually unmute yourself, as this is a webinar, not a meeting. You can ask your own questions at any time by typing into the Q&A panel. You can also upvote someone else's question if they're asking something that you would like to know. We'll be answering questions during the panel discussion, and there is also a chat panel where you can make comment during the presentation. You don't have to use these facilities, but they're worthwhile, and they're not that hard to use, so please have a go. This event is being recorded and it will be available after the webinar this morning on COTA New South Wales YouTube channel, along with our other webinars. So if your friends or relatives can't be here today, please refer them to the recording. Dying to Know is an annual campaign encouraging people to start conversations about death. And it's an initiative of the Groundswell Project. And one of my favourite messages from the project's manifesto is, talking about death never killed anyone, ever. The campaign encourages all of us to have conversations about death, dying and bereavement, to run workshops and to host events just like this one this morning. We all need to think about death, dying and grieving to provide a space to start conversation with friends, with families and with communities, to think about how we want to deal with our own death as individuals and as groups of people. And I think importantly, to develop a plan. Over the last couple of years, COTA New South Wales has undertaken some surveys, 2 in fact, important ones, in regards to this conversation today, to understand the views, experiences, and desires of older people when it comes to death and dying. Last year, COTA New South Wales released the 50 Plus report. This is on our website as well, and it was called Dignity, Respect, Choice, Planning for the Final Chapter. The report was a result of a survey that we carried out with 6,000 older people in New South Wales. And we also did a series of focus groups discussing the end-of-life planning documents, discussing palliative care, and importantly, the taboo regarding talking about this important part of everyone's life. Later in 2020, COTA New South Wales, we made a submission to the IPART review of competition costs and pricing in the funeral industry based on a smaller survey of older people's views and experiences with organising, planning and paying for funerals in New South Wales. Both of these reports highlight the issue of challenging the so-called taboo of discussing and addressing end-of-life issues. COTA New South Wales, like other organisations, we know that there is a great thirst for knowledge and willingness to discuss end-of-life options, and therefore we considered it a high priority for a topic for our 2021 webinars. Well, folks, we have some great speakers this morning, all of whom have worked in this space. We aim to get to many of your questions as possible, so just a quick reminder that you're able to ask questions or add your questions to the Q&A panel. So my first guest, I would like to welcome Susan Goldie. Now this morning we have a Susan and we have a Suzanne. This is Susan Goldie. Hi Susan, welcome. Susan moved from legal practice to the community sector 25 years ago. She has held senior roles in a range of community organisations, spanning mental health, cancer, community services, the alleviation of poverty, social enterprise, and end of life. Susan, we really look forward to your presentation. So over to you.
Joan, thank you so much. Thank you to COTA New South Wales, and it's lovely to be here with so many people across New South Wales during Dying to Know Day, week and month. And the silver lining to the dreadful COVID cloud is that instead of postponing lots of Dying to Know Day events, people are just spreading them out, working out how to do them differently. So thank you so much for hosting this wonderful event. Before I begin, can I just add my acknowledgement of the traditional owners of the lands in northern Sydney where I live and work, and pay my respects to elders past, present and emerging. And Megan, if you wouldn't mind just putting up my slides, that would be great. Thank you. And we'll move through them. Just jump onto straight to number 2, I think, Megan, if that's okay. Thank you. So, Joan, you've given us a lovely introduction to the Groundswell Project, which I very proudly represent here today. And there's a word that you're going to hear a few times from me and from some of our other wonderful panelists, which is about the word compassion. The Groundswell Project is absolutely about death and dying and grieving and good conversations. And with that comes the idea that we want to build communities which can respond compassionately to all these end-of-life issues. We want to increase death literacy. We're going to talk about that a bit more this morning. What on earth do we need to know? And again, you're in the hands of some fantastic panelists who are going to touch on lots of areas of important knowledge and awareness. And we want to increase the number of conversations about death and dying. They're big, scary conversations, and I think my role here this morning is to say they start with the simple question, with the simple over the dinner table conversation. They start simply. They don't have to be scary and they don't have to be complicated. Megan, could we jump to the next slide, please? Thank you. Dying to Know Day, as Joan has mentioned, is our flagship way of signalling the importance of these conversations. And it's easy to say that we need to talk more. The wonderful COTA New South Wales report highlights this, highlights the fact that many of us understand we need to talk more about death and dying, but we just don't know how to begin those conversations. So what I want to do is flag a few ways of thinking about what that conversation really is about, what it can be about, and just how we might go about starting it and thinking about it. So Megan, could you just jump to the next slide, which is our poster for this year's Dying to Know Day, and I really love it. The most important conversation you've never had. It can take you places you've never been. So let's start there. Why is it that we don't have these conversations? End of life is a life stage. We have lots of conversations about other life stages, preparing for parenthood, preparing for our work life, preparing for retirement. I think the first thing I want to suggest is that it's helpful to think about end of life not as the end of life stages, but as the next life stage. And it deserves our attention. And importantly, having that conversation is not about giving up. It's not about coming to the end of the road. It's about the next stage and how to live well, how to celebrate our lives, how to squeeze the juice out of every last stage. And that isn't to say that death is always, that end of life is always celebratory, that it's got some good aspects to it. Sometimes this end stage is going to be brutal. It's going to be ugly. It's not going to have the time we wanted. But surely they are all reasons why the conversation and the planning that is enabled by conversation is all the more important. I think for lots of us, we are frightened about the emotion that wells up in us when we think about talking about end of life. It's hard. I think culturally for many of us, we don't want to dive into that emotion. So part of having a conversation about end of life is spending a bit of time reflecting on ourselves and getting ourselves ready, and then picking the right moment and the right people. We think often that end of life conversations need to be with professionals. They need to be with our doctors, with our solicitors, with our advisors. But the period, the end of life stage is, it's estimated, up to 95% spent with our nearest and dearest, not with our professional advisors. So it's those people we need to have the conversations with. They are the most important participants in these conversations. We'll come back, I think, during the course of the morning to some of the things, a lot of the things, in fact, that these conversations cover, but certainly they should not be one conversation. They need to be conversations held over a period of time. You need to keep coming back and revisiting your plans, whatever they are. And there are important documents that we can use to record our wishes, record our hopes and our fears, record those aspects of legally binding or important clinical information that we want noted. But don't let the prospect of difficult, scary documents keep you away from this conversation, because the best part, the most important part of this conversation is thinking about, what are my values? How do I want to live well in this life stage? What are the things that really matter to me? And those things can best be discussed with the people in your life. When you do move beyond conversation and think about ideally what you might want to write down, then it is important to get the right advice. Talk to your GP. Talk to your clinical carers. Talk to your solicitor. Advanced care planning, there's a whole lot of language in there that gets very confusing, but very simply put, and Megan, if you could just jump to the next slide, please. I think of advanced care planning as a process that covers everything from that first conversation at the dinner table to say, oh, this is a bit uncomfortable, but I've been thinking about a few things and I really want to talk to you, whoever that person across the table might be. So it's a process where we think about what matters to us, where we think about how we want to live this next stage, right through to the way in which we document a range of documents which take effect, some of them before we die and some of them after we die. There are specific documents for different parts of this. Some documents will only take effect while we are able to make decisions for ourselves. Some documents will take effect only after we can no longer make decisions for ourselves. Some documents are important while we are alive, and some documents don't start taking any effect until we're dead. So it can be a little bit, not a little bit complicated, it can be quite complicated, but don't let that put you off. There are great resources on the COTA New South Wales website, on the Groundswell website. I've put up an image there from Advanced Care Planning Australia, which covers documentation for every state and territory. Please start with the conversations. That's the place to start. And let those conversations lead you through the questions that you need to know, the information you need, and that's where what we call death literacy becomes so important, through to the ways in which you want to record what matters to you. It's highly personal. It needs to be about each of us. It needs to, whatever your conversations and whatever your planning process, make sure that it is about you and your family and what matters most to all of you. So I think, Joan, unless you want to name lots of different documents, I'm going to leave it there with the message. And Megan, if you wouldn't mind jumping to the final slide, that it is as simple as starting a conversation about the next stage in our lives and who we want to have those conversations with. Thank you very much.
Susan, thank you. I think one of the most important things that you shared with us, that doing this planning is part of living. In a way, I think it's part of our responsibilities. I guess as we all get older, we've also got a list of things that we want to tick off too. So I think that should be part of the plan. I remember when I got all of my legal documents together, I only have one child, and I presented him with all of the things that he was responsible for. And then I went through the Advanced Care Directive and he said, Mum, stop. It's all too much. Can you just sort of pace this conversation? So I learned a quick lesson. So you can't sort of throw it at your loved ones all in one heap, especially if they're your children, I think, or someone that's very close to you, like a friend. You need to pace those conversations.
And Joan, I think that idea that we've got time and we need to slow it down, slow everything down, is a very powerful message. So thank you.
Thank you, Susan. Great. All right. Well, Susan will come back to us during the panel discussion and there'll be more things to talk about. I'd now like to introduce Leanne Wein. Excuse me. Leanne has worked in the funeral industry for 8 years. Her love of funeral processes and rituals came from her community experiences in Catholic religious life, where she witnessed beautiful community care of the dying and the dead. Leanne, thanks for joining us, and over to you.
Thank you, Joan. Thank you, COTA, for having us here today from Tender, and to everybody joining us today, hello. I'm here just really to talk to you about the role of a funeral director and how I see my role really is. I'm making this quite personal today as a funeral director. Our role as a funeral director is simply to support you in the process of organising basically a cremation or a burial. There's a bit of legal paperwork that has to be done in that we are required to assist you with. The care of the deceased is important legally. There has to be a mortuary engaged in that process. So the coffining of a deceased has to happen in the mortuary of a funeral home. And then from then on, our role is to assist you with the funeral ceremony itself, where necessary. Really, how much involvement you need from us is really up to you. And that's a really important message I want everyone to hear today, that really you're the expert here. And our role as funeral directors really is simply to guide you through that and make sure that, all the basic legal procedures are done. But the rest is really up to you. And the way that I see this and the way that I know we here see this is that grief and loss is, while it's an event in your life, it's actually a process, and it's an opportunity and a process for transformation. And the reason for that is that it's very personal, and it's also very normal. It can happen to all of us, and all of us will have to engage in this process in some way in our life at some point. So I've got a few helpful tips to share with you all. The first one that I really want to say, and Joan has touched and Susan have touched on this, is take your time. Please, please take your time. There is no rush. Sometimes I can take a call in the middle of the night and it's a nurse in a nursing home wanting us to come straight away. And there is a process of engaging, checking with the doctor and ringing the family. And apart from that, there is so much more that can happen. There is time for you to visit the aged care facility and to even wash and dress your loved one in that facility before they even come to the funeral director. You can do that. That's a conversation that you can have with that aged care facility. Even perhaps even a hospital. In COVID time, that might be a little bit limited, but that's still a conversation that you can have if you really want that. And there's time for you to go and sit with that person, or even to be zoomed in, and to slow that down. It's really important for everyone to know that we have 8 hours once you've engaged us. So there needs to be no rush. It's a process that needs to be really honoured. So you have time to step through this and consider everything you need to consider for you and for your community and for your family and everybody involved. You get one go at this. And while it's really normal, it's also important to hold that with great respect. That this is a process, and that process is going to be different for every single person. There is not one funeral that I have attended or one family that I've met that's the same at all. And there's no right way to do this. There is only a few legal steps that need to happen, but there is no right way to do this. It's just your way, and your way is the right way. And really what you need to do makes you the expert and really in leading the way for a funeral director to support you. So having said that, the second point I'd like to make is really consider your choices when the time comes. Take time to do that. Talk with your community. Consider how you want to say goodbye. Talk with your friends. There's a couple of options that you do have. If you talk with different funeral directors, find one that's going to help you to say goodbye in the way that you need to do that. Have really good conversations with them. Go and meet them beforehand. You'll know as soon as you walk in the door which one's right for you. ask them questions about their values and about how they see the ceremony. You don't have to be sold things. You don't have to have choices given to you. You can take those options in and ask them to work with you. It's really important that that happens for you. For example, if you don't like their range of coffins, you can ask them to order you one in. You can buy one yourself. In New South Wales, every state's different. In New South Wales does require that the deceased is placed in a coffin. You do have to have that. But you have some choices around that. You can take the coffin home and decorate it. You can write all over it. You can put graffiti on it. You can put stickers, photos all over it. You can line it with, you know, your nan's favourite sheets. There's a whole lot of beautiful personal things that you can do, but take your time to do that and have those important decisions with each other. I just want to talk about pre-arranging for a moment. It's important that you have these decisions and make these decisions beforehand and have these conversations, because by the time it gets to the will, it's too late. And we all know that. There's a lot of fantastic material around, and Joan and Susan mentioned some of those already for pre-arranging. One of the things you can do that's extremely helpful for you and for your family is to fill out the births, deaths and marriages form. When your family sits to do an arrangement with us, that's information that we need. And sometimes that can create a lot of stress for a family that don't have that information about death, dates and details about names. And can you hear me a bit better? I'm getting a message to speak up. Just turning my volume. Oh, that's better. Here we go. Very big apologies, everyone. I'm sorry. Yes, so the births, deaths and marriages form is something you can do that will be enormously helpful to your family. Fill out all the details. You can get that from your birth and marriage certificates. If you can have those available to your family, that would be really helpful. Some of the other paperwork you can pre-fill in as well, which would be helpful to a point. But the most helpful one is the births, deaths and marriages form, I think. That sometimes that really throws people. The other thing you can do in pre-arranging is have a conversation with, I know you're going to hear from a doula today, and I'm really excited about that. Because the families that I've cared for that have engaged with a doula to have all sorts of wonderful conversations around decisions that they and choices and how they want to go about that are really empowered. They really know what they need and how to move forward. And I can't encourage that enough. And if it's not a doula, if you have a church ministry team, engage them with the conversation. Some of those are very trained in funeral specific work. So I would really encourage you to do that.
Susan, someone just posted, where can you get that form from?
You can get that directly from births, deaths and marriages. You can also get it from your funeral director. And they can simply post it out to you.
Sorry, yes, I meant to say Leanne, I'm very sorry. The other question that came through, Leanne, was can people stay at home before they actually are buried? Or do they have to go from mortuary too?
Yeah, the only thing that has to happen in a mortuary is, sorry, before I get to that, David's just asked, what is that form called? It's the form to register a death. So if you were to email births, deaths and marriages, they have that on hand. You could probably actually download it from their website, to be honest. I would encourage you to do that. Yeah, or contact your local funeral director. They will just email it straight out to you. You're welcome, David. Okay. Mortuary, if you can die, if you want to be at home, absolutely you can. You can. However, a person must be coffined in a mortuary. So unfortunately, so what has happened with us, for people with different cultural practices, sometimes we've had to bring the person into our care and the family has come along, and we encourage our mortuary is a sacred space. It's also a very public space, and we invite everyone to come and wash and dress their loved one and be part of the coffining if they would like that. So, for example, people have followed, they've come to our facility, they have coffined their deceased loved one, and then we've taken them back home, and we have a cool plate that sits underneath the coffin. So that coffin then will be placed on a cool plate for a couple of days, I think. Will be okay. I wouldn't leave it too long. And look, this depends on how the person's died and how well they are, and everybody's body changes differently. But a cool plate will help, and that's legally it's okay to do that. Sometimes when somebody has died, somebody wants to just spend one last night sleeping beside whether it's a child or a husband or a partner, and you can hire a cool plate from us, and it's simply a matter of putting that underneath the deceased person, and they can do that, which is actually really beautiful. There are many options, and talk to your funeral homes because they all have their own options, and you will find the right one that suits you.
Thanks very much, Leanne.
That's all right. Just a quick note on doing your pre-arranging. There's a lovely, lovely movement now of getting the paperwork moving. And I hear people talk about, I'm arranging my own funeral, which is fantastic and helpful. But I just want to flag that with a caution and say, please remember that you won't be the person grieving, and that the people who are grieving will need to consider what you want, but they also need to move through this in their own way and their own process of transformation. And it's really important that they have a little bit of freedom to do that. Great for them to know what your favourite poem is, what your music is, but also give them a bit of space too. I have had some people who have sat with me and said, I didn't really want it this way, but this is how Mum wanted it. So it limits them. And I'm sure you wouldn't want that for the people that you love. So I just want to add that factor to the picture. And I think that's pretty much all I have to say, really. Just consider your options, and COVID doesn't need to be, limits don't need to be less. It's just requiring us to be creative thinkers and, think outside the square a little bit, which is a little bit, it's good. So thank you.
Thank you very much, Leanne. I think what I've taken out of your short presentation was about honouring the people that you love, and making sure that it's a personal experience, and making sure it's very much about the person rather than the sort of set deal that some funeral directors. It's sort of like a package rather than being person-centred and a personal experience for those people who want to grieve. I've actually had a couple of good experiences with people who have done their own funerals, but they have been not the people that are grieving. They've been a friend who has decided to take on that role. So again, it's a very personal thing, and there are many options. So your key message is to explore those options and find the right one for you. Okay, thanks very much, Leanne. So our last speaker, before we move on to the panel discussion, is Susan Gorman. Suzanne is an end-of-life doula. Now, Leanne mentioned doula, and I don't know how many people out there know what a doula is. Of course, I can't see you, but so I was having a chat to Suzanne before we started the webinar, and she'll explain what an end-of-life doula is. And she's had 30 plus years experience in her nursing career. Her calling to become an end-of-life doula followed her parents' deaths in 2018 and 2019. It's a great honour to welcome you, Suzanne.
Thanks, Joan. Thank you, COTA, for inviting me to chat today, and hello everyone at home. And I've just got 3 slides that I'll have going whilst I talk, so I'll just cut to those now. You can still see me as a little ant. And, you know, when my parents died, I didn't know what a death doula or an end-of-life doula was either. I had heard of doulas in the birthing space for support people, for women during their pregnancy and birth. And then I read an article one day and went, wow, that's a death doula. And so the word doula, it's actually a Greek word meaning women's servant. And there are other names for it. You've already heard us say end-of-life doula or death doula. There's also death midwife or soul midwife or death walker. We're all the same people providing the same role. And being a doula, an end-of-life doula, it's a non-medical role, and we're really providing practical and emotional support for people, really identifying their end-of-life wishes and ensuring that those wishes are fulfilled. And I'll just go on to my next slide, just bear with me. With that, yes, our key role is really working with a person or working with the family or their carer to really, it is focusing on their end-of-life wishes, really also addressing what are their fears, because a lot of things to do with end-of-life, there is fear or stereotypical fear around what that is, and we really work through that with the person or the group of people, and providing a lot of education and resources. If I wanted to break it down, the role, doulas can provide just a little bit, or they can have a very broad range of services of what they do. But breaking it down, there's 3 categories. There's a lot of pre-death planning and preparation. Then there's the second component, which is being present during the dying process, otherwise known as vigiling. And then the third component is guidance in after-death care. And some doulas provide across the spectrum all of these things. Some specialise in the pre, some really specialise in the after-death care. I myself, I'm a Sydney-based doula, and I provide all 3 components. My particular specialty is the vigiling. But to have the end-of-life wishes fulfilled, the key part is the planning. And I just wanted to say, you don't have to be living with a life-limiting diagnosis. You don't have to be dying to utilise this service. In fact, if you're well, that's a really great time to, like anything with the planning with end of life and death, is doing things and thinking about these things, starting these conversations when you're well. And as a doula, we can help you start those conversations. So in this planning and preparation phase, I'll just give you a tinsy snapshot, but there could be education, and quite a lot of this I do, is education around the dying process, what it is and what is involved at the end, once someone has died, because that's where a lot of questions and fears do lie for people that have never had an experience with death in the past. And we also can help support these conversations to really bring peace to that person who might have had some troubles with family members or communications in the past, and really give them some peace. A key component is really drilling down and compiling a checklist, setting the scene for them so they know what that scene will be when they're dying or at the time of death. It could be things like, what music do they want played? What lighting do they want? Do they want candles? Do they want the window open with fresh air? Are there specific religious, cultural or spiritual rituals they might want to have performed at that time? Who do they want to have around them? The list is endless, and believe me, we all have choices, and we probably think about it in my head and laugh to people, oh, I want that played when I'm, leaving this world. It's one thing to say it, but really to write it down or plan it with someone is really crucial to ensure that it happens. And another key role is coordination of a support or care team, because dying for the people around the dying person is exhausting. It's exhausting for the person dying too, but for the care team, you can't expect just one person to be 24 hours a day being everything. So as a doula, I can help coordinate that. In the time of COVID and restrictions, it's even more crucial to have a great coordination and support team. And the support team could be family, friends, neighbours, your community that you're a part of. So then, being present during the dying process, the vigiling stage, this is setting a sacred space for this person and really ensuring that we're supporting them to have that authentic death that they want. And as a doula, I can be in the background, just mentoring, guiding, supporting you or your family. I could be doing that from afar. I could be doing it virtually, or I could be in your home. I can just be outside on the other side of the door. Some families want me to be actively involved as a carer, and that's fine too, and actually be there with them. Again, it's all about giving confidence and reassurance at that time. And again, being present for those who may not have people around them. We provide that as well. And I think it's really important for me to emphasise that we're there to really be present non-judgmentally for that person. Again, at this phase, we're really ensuring that everything that we planned for with that person is being followed through and adhered to and honoured at this time. Once the person has died, then as a doula, I'll guide people in after-death care. So that's supporting them and being present at the time of death, guiding them in carrying out some of those after-death care rituals. Might be with washing the person, dressing the person, grooming the person, and just giving them, again, confidence to let that process happen. And I also just wanted to say that discussion and planning, it really builds confidence and reassurance, and the doula really helps provide that at this time. So how do I get involved? The processes of what I do to ensure the planning and being present in that dying process and the after-death care is asking lots and lots of questions. If you involve me, I will be asking you lots of questions. It's not about my opinion on things. It's about what you want. So I have to ask a lot of questions to make sure that we can all get that right and that you can articulate that to us and to your loved ones. I'll be holding conversations with you, help facilitate discussions that might be difficult with you or your family, whoever is involved. Really listening, really concentrating, holding space where it's just about you. And with that, if I don't know, if there's certain things you want, I will then be able to go away and research it if I don't know that answer already. And I do spend quite a bit of time researching. Somebody was wanting urns the other day. So I spent a significant amount of time looking for urns that weren't your traditional urns, because that's what that person was wanting, non-traditional. Our role as doulas also is to provide those resources to you. And really, we're there to really be beside you or in the background, however you want it to be, and educate, support and reassure you. That's really it in a nutshell, Jane and everybody.
All right, thank you very much, Suzanne. Suzanne, there's been a couple of questions that came through as you were talking. One of them is about how much do you cost? Is there a cost?
There is a cost. I don't often volunteer my services in this way because we do see it as a really vital service. And I charge an hourly rate. I offer packages of 3 or 5 hours as well, and I do offer a 24-hour vigiling rate. Now, I'm not going to say what that fee is here now. People can contact me individually after this if that's what they're interested in, because different doulas charge different prices. There's different levels of experience with the doulas, and obviously, yes, a rate when you're there for 24 hours is going to be different to if you're just wanting a little bit of information, fact-finding to be done along the way.
Okay, thank you. A few questions have come through and they're actually quite legal questions. So I would recommend to people that you check with solicitors. Later we're going to talk about the documents, and there is a service that COTA New South Wales runs called Legal Pathways, and that can help as well around some of those legal questions. I think what Suzanne shared too, which is so important, is to have that checklist, isn't it? Have the checklist for your funeral. My people in my family, they know what sort of music I want. 2 pieces. Bette Midler is one. I won't tell you what the other one is. They know what sort of food to serve and wine, and also some, I think importantly, writing down some things about your life that you want to be shared with the people that are going to attend your funeral is important, because how many of us have been to funerals, and I think even people that I thought I knew well, and I thought I didn't know that about them, you know, so that a person's life that can be beautifully said through a eulogy, and I've had the honour of doing many eulogies for friends and family. I think that's a really important part of the grieving process. And they can be, you know, it can be lots of fun. People laugh, they cry, and that's really important as well. Okay, folks, so let's get into the questions. I hope everyone's enjoying it so far. I certainly am, and learning a lot. We have another panellist with us, and that's a fellow board director of mine at COTA New South Wales, Dr Stephen Ginsborg. Stephen has been with us at COTA New South Wales for some time, and he came to us because he has a great passion, of course, for issues to do with older people. He's a GP on the northern beaches of Sydney, and he's worked with the Groundswell Project as well. But Stephen's greatest passion at the moment that he keeps reminding all the board directors constantly about is the model of compassionate communities, and he wants to bring that to Australia and probably the world, I think. So, folks, a quick reminder. You can ask questions in the Q&A panel at the bottom of your screen, and there's lots of people who are, lots of chats. I can't really keep up with them, and I'm trying to look and I'm doing this, but anyway, bear with me. It's all an interesting process. So, Stephen, I would like to start with you. So the other panelists, if you can just go on mute until I ask you a question, that'd be great. Stephen, I'd like to start with you. You've worked with people in aged care and through the final stages of their lives. Can you tell us what you've noticed is different in people's dying when they've had conversation with their family and friends?
Yes, thank you, Joan, and hello, everyone. I'd also like to acknowledge First Nations people and their elders, from whom we have so much to learn about life and death. And I'd also like to acknowledge that there are many different cultural beliefs and preferences around death. And I also want to acknowledge how confronting and disturbing this conversation might be for some of the people who are on this webinar. So to your question, Joan, simply answered, it makes a huge difference. And if I was to be really honest, I'd now turn off my video and turn off my audio and say, this answer can be given very, very well by all of the other participants. Doctors have had too much of a go in all of this for the last century. Death has become over-medicalized. I think Susan said, we know the difference it makes to have discussions about birth. Think of the antenatal classes. And we doctors have closed down this discussion about death. And so it's not surprising that there are many bad deaths. It's time to return the conversation and the care of death to the community. So as I said, I could just turn myself off at this point. There are statistics, as Susan pointed out, and the medical statistics are that probably only 5% of deaths require intense medical intervention. The rest is like Winnie the Pooh. There's a couple of lovely little cartoons. There's Pooh and Piglet. Don't walk behind me, I may not lead. Don't walk in front of me, I may not follow. Just walk beside me and be my friend. That's really our role. And so I find that deaths, good deaths, occur when that principle and principles that both Suzanne, Leanne and Susan have all shared with us, when those are in place, that makes for a good death. So maybe just a couple of simple stories. One is about a good death. The family did prepare in all the ways that we spoke of. I encouraged them to ask anyone that they knew, go through the phone book, see if they can find a nurse who's retired, a little bit of expertise. I'm told that to learn most of the nursing contributions to a good death takes about 10 minutes to learn how to turn and issues like that. So they did this, and they got a group of about 10 people who we like to call a compassionate community around them. And their dear mother, who had a stroke, and they decided that this was time to bring in their group of friends. Children were running in and out of the room saying, "Oh, bye-bye, Granny." And Granny might wake up and say, "Bye-bye, dear." And the husband was there, but didn't have to do any of the caring because the family was supported. That's a good death. That doesn't mean you can't have a good death in hospital or an aged care facility. But I was called in very late to an aged care facility once because I was there and there was no one else there, to a room filled with grieving family. The dying person was lying there quite comfortably, but it was obvious that that dying person was going to die fairly soon. I said to everyone, "Now look, is everyone who wants to see Mum in her last hours here?" And they looked at me in shock, and they said, "But Mum couldn't die tonight." And their anxiety and their fear, the fact that no one had spoken to them about the process, that then started to communicate itself to the dying person, who became much more agitated. That's a bad death, but there are worse, where pain relief isn't given when appropriate. It's pretty simple, and maybe we'll come to that when we discuss palliative care. So there were too many bad deaths, and too much done in the health system. More needs to be done by compassionate and knowledgeable communities.
Mm-hmm. Thank you very much, Stephen. Susan, you know, I mentioned a report that COTA New South Wales had done, and you referred to it in your presentation as well. And in that report, 50% of people said they didn't feel comfortable actually starting the discussion. Now, we've touched on this, but I guess we really want to have some ideas, have some hints about, can you tell us how you can just get that conversation happening? We know it's so important. Everyone's told us it's important. 50% of the people we surveyed said, I can't start it. I don't know how to.
It's a great question, Joan. And I think the first issue is that many of us don't know what the questions are. We don't know what we don't know. And that's why death literacy and information, getting information out into the community about death and dying is so crucial, why these sorts of presentations are so crucial. So that's the first thing. COTA's doing a great job. The report highlights the real imperative to get more information out into the community. So my first suggestion is jump onto a website or a Zoom session like this and get a bit of a sense of what the questions are about that last stage. What does palliative care mean? What does it mean to say, I don't want treatment? What does advanced care planning mean? What are my choices around funeral rights and death rights? What is the role of a doula? Who can help me in the community? Who can help me in terms of my medical and legal advisors or my advisors? So that's my first observation, get some information. Secondly, as I think I mentioned earlier, take a little bit of time out to reflect and think about what is what scares me about this conversation, and who is the right person to start it with. So that means prepare for the conversation, I think. Thirdly, a light touch. You don't have to jump in and say, right, guys, we've got to sit down for the next 3 hours because I've got to plan the whole lot and sign it off, and someone's got to watch me. It might be, I've been wondering about changing my will, or gee, I don't have a will, or I've just, we've got to talk about this diagnosis, or my health has shifted. Often I think that the starting point is going to be around a change. And around that change, you can raise these other questions. But the most important thing is to think about this conversation, I believe, in terms of living well until I'm dead. We don't stop living just because we start talking about dying. We live better because, as both Suzanne and Leanne have pointed out, Stephen, you've just highlighted, because we feel better, our family, our friends, our supporters feel more confident to help us through this stage to execute our wishes before we're dead, after we're dead. Everyone's going to feel better. So hold that thought when you're thinking about how scary this conversation might be, because chances are it's going to end up being a fabulous conversation.
Okay.
Oh, you're mute. Joan, you're mute.
Yep, sorry. My question is to Suzanne. So, Susan, you've said there's sort of no right time, and I like that whole idea that you have to keep living and have the conversations, and it might be over many years. It's not one of those things you want to jam into one session, as I tried to with my son, and it didn't work, as I said. So, Suzanne, when you're with people in that sort of planning stage, from your experience, what's helped people have that conversation? Is it their personality? Is it their beliefs or their values? What can you tell us from your experience?
From my experience, I usually find that there's something inside them that's usually a fear or a want. And I'll ask them, particularly if they've just brought on my service, and I'll say, what is it that led you to wanting to bring me here to chat with you or meet with you? Because there will be a reason. Might be a small thing, might be a large thing. And I will, with that person, suggest what is that? And then what is your greatest fear or concern, or what do you want to achieve? Depending on whether they're currently a well person or which stage of their life they're at, I will frame a question around time. And from there, it might be that it's to do with themselves. It could be that they've got a question about their family. I'm worried about my wife or husband, how they're going to handle things when I'm not here. Or this is what I want, but I don't know that they want me to be doing that. So it's framing up a question for whoever the person is at that point. But I will always start with, what is it they're really wanting to find out from me, and what is their fear or concern?
Yes, I think it's, as we are living in these strange times, we have all learned, even more importantly, the gem of good conversations, the importance of conversations and spending time, and we've got time to do that now. The next topic I want to explore is about palliative care. And we know from the research that COTA New South Wales has done that most people prefer to be cared for at home at the end of their life. And as Stephen said, we've probably over-medicalised death in many ways. And yet hospitalisations for the end of life are actually on the increase. So I think there's a great dilemma in terms of end-of-life policy and a social policy. So Stephen, can you talk to us about palliative care? How do people access it? At what point does it become available? And can it keep people at home to die? Which I think is so important.
Sure. So maybe it's just helpful, but there's huge misunderstandings about palliative care, and it's become as scary as, or sometimes scarier than death itself, because people regard it as the least favoured speciality in medicine. So the World Health Organization, excuse me, I'll read it out. It defines palliative care as an approach that improves the quality of life of patients and their families facing the problems associated with life-threatening illness through the prevention and relief of suffering by means of early identification and impeccable assessment and treatment of pain and other challenges, physical, social, psychosocial, and spiritual. So really, this fits very well with the idea of having the conversation, because most of those things, apart from the relief of pain, which is a very, very simple medical challenge in 95% of people who are dying, is having the conversation. So it's not a last minute concept. Michelle and President Obama, one of the first things they did when he was elected in his first year was to announce that they had done their advanced care planning. They ensured that the Surgeon General made this very clear to people. There is no time too late or too early to start talking about palliative care. So palliative care is a conversation, basically. Anyone can access it. It varies in terms of its availability in different areas, and there is a big divide in New South Wales between metro and rural. But some are better funded than others. Some have more capacity to have a very early conversation with you about your concerns. So if you are in a hospital situation or with a specialist in an oncological clinic, ask, can I see a palliative care physician? It doesn't mean you're anywhere near end of life. The Liverpool gold standard was 5 years out of when death was expected. This was regarded as impractical, and it was going to overload the system. So now we say, if you as a doctor, if you walk into the room and you think that that person may die in the next year, then consider palliative care. I hope that goes a little way to answer the question.
Thanks, Stephen. And I mean, the important thing is that a palliative care team doesn't have to be the medical people. A palliative care team can be families, volunteers who decide that they want to care for that person at home in a palliative care situation.
95% is done by non-professionals.
Which is part of that, what we call the compassionate communities model. So Suzanne, as a doula, do you get involved in palliative care?
Absolutely, and
so.
and it's our number one belief that if somebody has invited us to work with them and they haven't already reached out to palliative care, and that is one of the first things I would be asking them. And particularly if the discussion is, I'd really like to stay out of hospital, or I'd really like to try and die at home. Well, it is essential to have your palliative care team involved, because they're a multidisciplinary team of people from medical, nursing, allied health, volunteers who have so many resources that make it possible for you to have that death at home. You may not end up dying at home, but you still need these resources, and it makes everybody's life so much better and so much easier to have access to that. So if somebody hadn't had palliative care already or hadn't been referred already, I would be suggesting that their loved ones have the discussion with their loved ones, have the discussion with their GP. As Stephen had said this as well, have the discussion with your medical specialists who are treating you as well, because there's more than one way to skin a cat here to get involved with palliative care. And often I have just, conversations with, whether it's work colleagues or friends, and they'll mention something about one of their loved ones. I'll say, oh, have you got the palliative care team involved yet? oh, no, we're not at that point yet. And I'm thinking, this is the point. This is the time. You don't wait till 48 hours when you think you're at the pointy end here. That is not the time to have palliative care involved. Well, it is, but you really want them involved much sooner. So from that perspective, yes. If palliative care is already involved once they've invited me in to help them, then I'm really there to still just support, guide and reinforce what palliative care are doing. I too become a part of that broader multidisciplinary palliative care team, really there to supervise, make sure that the prescribed medications that person is supposed to be taking, that they're taking them. I'm not administering them, but I'm supervising like any other carer would. Or if there's something that doesn't seem right, perhaps their nausea or pain relief isn't being managed, or that they don't seem safe, maybe they're ready for that different bed that goes up and down so they can get in and out more safely, which palliative care gives you those wonderful resources to contact for equipment that I will then be saying, you might want to go back to your palliative care team or go back to your doctor, make that appointment, let them know how you're feeling, that you're not feeling so well, because that's what the role is about. We're working together to ensure that person is having really the best experience they can have at that stage of their life.
Okay, Susan, thank you. Stephen or Susan, there's a question that's come through about, do any of you, any of the panelists, or particularly Stephen might know this, or Suzanne, you might, the palliative care costs. What are the costs around a good palliative care situation?
Nothing.
Okay, good. Well, that's what I want to hear.
It's all in the public system.
Okay, terrific.
Which is why there aren't many palliative care specialists joining the profession, because you don't earn much money from it.
No, that's a crying shame. And I think, you know, the other thing that I'm worried about, and Stephen, you actually talked to this, is, you know, a lot of us live in bigger centres and bigger cities, and I do worry about people who are alone in very rural and remote communities and don't have access to these services. So I think that's an issue that never needs to be forgotten. Susan, there's so many people that want to help. And, you know, I'm always pushing into my family and friends' life around this because I feel it's so important, and they go, back off, Joan, back off, because I can be a little bit pushy sometimes. But for people who really want to help, just give them just a few hints about how they can get involved without being sort of too pushy like me.
Joan, I'm sure you're not too pushy. This is where compassion and the idea of compassionate communities, Stephen's championship of this concept, is so important. There are so many of us who feel the emotion and the distress of a family holding the space for a dying loved one, but compassion is about that feeling of empathy plus the motivation to do something. So on the one hand, I think culturally many of us feel we should never ask for anything from anybody, that we should be able to do it ourselves. I think you've got to ditch that notion. And secondly, when you're feeling helpless but you want to help, you don't have to know. You don't have to be a palliative care clinician or a GP or a nurse. Just ask the question, because the answer might be, gee, could you mow the lawn? Could you take the dog for a walk? Could you pick up some takeaway because we are so sick of cooking? It may be quite a surprising thing that is causing distress in a family holding this space, going through this. So please don't be shy, just ask, and be prepared to be repelled, because someone said, I can't even think about the answer to that today, but I love that you asked the question. Sometimes it might just take a traffic cop like a doula or a particular family member to say, I'm going to put together a few lists and you're on the roster. There are lots of ways of doing it. You might not know the way, but please don't be shy, just ask. And as Stephen flagged, palliative care at its broadest is about the spiritual, the psychosocial, the social outcomes, not only for the person dying, but for their family. And we, as neighbours, as family, friends, play that part, build that fabric of compassion around this family.
Okay, thanks, Susan, very much. The next topic we want to get on to are those legal planning documents that a few of our speakers have referred to. And we know from the work that COTA New South Wales has done that a lot of the people that we survey, they have a will in place, so that's a good thing. But almost, I think it was about 20% of people said it didn't actually represent their current wishes. So they did it, a while back, and now things have changed. We know from the work that we've done talking to older people that many people don't understand the difference between a power of attorney and enduring power of attorney, and they're less likely to have an enduring power of attorney in place. Even fewer people have an enduring guardian or a substitute decision maker in place, and fewer again have made advance care directive, and we've talked a lot about that during the session this morning. We know from what we've learnt today, and many people out there know this already, that we have to have these legal planning documents in place. It's the best way to have your wishes understood and implemented and your affairs in order. But we also see from our research that there's a bit of confusion about the purpose and the benefits of these documents. So let's go to our panellists. So Suzanne, we'll start with you. Is there a priority order on the documents, or do you just get them all done at once, like I did? And we also, I suppose, we need to be updating them too. So what do you think?
Well, look, it's very individual. Some people are very driven to get all these things done at once, and it gives them a sense of well-being to know that they've got everything in place. But certainly with wills,
Suzanne, we just lost your sound. So while you're trying to get your sound back on, Stephen, we might go to you. No, we still can't hear you. We in the presentations this morning, we had a look at, we can get advanced care directives online. It's a big undertaking, but can you tell us whether you think it's worthwhile? Is it worth doing?
Well, first, just to carry on what Suzanne, I think, was going to say, is just go about them in a slow, ordered fashion. They're not too complicated. They get some help, legal centres, etc. Now, I think when we regard it as work, we're probably going the wrong way about it. So, Joan, you mentioned Groundswell's manifesto, which comes as a tea towel, interestingly enough. And in that tea
Good
towel,
advertising.
it suggests that these conversations and this planning can be done around the dinner table. And in fact, Dying to Talk, which is an organisation we'll put up on the web, they've got a pack of cards. So you can even make it a card evening, and the cards, you serve them out and then you discuss them, to have someone to advocate for me, not being alone, not being short of breath. What are your concerns? To be free from anxiety, having a pre-wake with my family and friends before I die. So that's the document that you might want to fill out in New South Wales or have a look at. It's available on the web. And then the Dying to Talk people have lovely little conversation starters, which are in Aboriginal form or for other people. So don't make it work, make an evening of it or a picnic of it or whatever, but do have the conversation.
Yes, that's a common theme. Sorry, Susan. Oh, good, you're back.
Oh, I'm back.
Thanks,
Yeah,
Susan.
sorry, my battery on my mic died, but that's all right. We're very agile here. So yes, I love those resources that Stephen was just presenting. I think the dyingtotalk.org.au is a wonderful website with lots of great resources there. Just going back to the legal and advanced care planning side of things. Obviously speaking with professionals at a time that is reasonable with yourselves about wills, power of attorneys, enduring guardianships, essential. If you want your medical wishes to be respected when you are unable to speak for yourself, it is essential that you, have this discussion with someone so they know what they are, and then put the appropriate processes in place so that it can be recognised. And with that, one is having a legal appointing an enduring guardian, and that will take a legal side to draw that up for you. And obviously also having that advanced care plan, as Stephen showed, and Advanced Care Planning Australia, as Susan had highlighted in her presentation, is a really great place to help prompt your thinking and to perhaps write down some of those medical wishes. And then again, it's all good to have it written down. You think, oh, goody, I've done that. But unless you've shared it with someone or told someone where it is, there's no good at sitting in the bedside table at home. Somebody needs to know about it, where it is, in the event that needs to be accessed. Share it with your GP as well. Often hospitals will contact the GP for this information. So that is a great place to also have it stored. As you mentioned, Joan, it's not set and forget. I mean, it'd be great if we did that in our lives, tick the box, it's done. However, our wishes in life sometimes change from time to time. So things that you might have thought about 2 years ago, you've probably changed your mind now, or I've updated that slightly. So that means really reviewing that advanced care plan at regular intervals. And that's really, I think, and just going back to enduring guardian, is think about the person you really like, who really thinks like you would think, and who really knows what you would want, not just your husband. I don't have my husband as my enduring guardian. And I know that sounds crazy. I'm a twin, and I have my twin sister who is also a background of being a registered nurse. And even if she wasn't a twin, she's still someone who understands what I want, and she understands things also from a health perspective. So I know that if something were to happen to me, she would pretty much echo my sentiment of what I wanted. So I have legally appointed her, and she knows that as well. So it doesn't have to be that the person's a medical person, but I think they really do need to understand how you think, and that you've had that discussion with them so that they know that they're that person.
Mm-hmm. And Susan, how can you make sure, though, that what you've written in your advanced care directive is actually followed and it's legally followed? You know, how does that happen?
Joan, I think Suzanne has answered a lot of the question. Having the right person in place as your substitute decision maker, and of course that role only comes alive if I am no longer able to make decisions for myself. And as Suzanne said, making sure that the documents are where they need to be, uploading it to an e-health record if you're comfortable to do that, is also a really good way to ensure that, bearing in mind that different jurisdictions, if you and your family are spread across different states, not that we can do anything about that at the moment, but if there's different jurisdictional issues, be aware that the best version of your documentation, which has been properly executed with the help of your GP and your legal advisors, will increase your chances that across state borders your documentation will be recognised. There's that sort of two lines run through my head. Somebody over mum's or dad's sick bed saying, this is what will be really good for mum. Or somebody who is my substitute decision maker saying, this is what mum wants. And however you achieve that latter position, make sure that the people who matter have got a copy of your documentation.
Great. Great advice. Thank you. Thank you, Susan. Now, we haven't forgotten you, Leanne, but we're getting now to the stage where we all have to think about we've died. So we want to have a bit more of a conversation about what happens. And we know from some of the work that we've done talking to older people about the funeral industry, they really didn't get the service that they wanted. And older people sort of felt they weren't well served by the funeral industry. I think maybe it was because the lack of knowledge about their options and rights. And as we've talked a little bit before this morning, that funerals tend to sometimes be one size fits all. And we've learnt this morning that no, they have to be personalised. They have to honour the person. They have to be really, really special for the people who are grieving. Less than 20% of older people reported understanding the laws related to the disposal of body, funeral and reporting requirements and dying at home. So they didn't quite have any knowledge around that. So Leanne, can you tell us about it? You don't have to have a funeral director involved. We sort of have learned that. You can organise a funeral without a funeral director, but you still need to have a plan in place, don't you? I mean, you still need to have a plan about how you want your funeral to be. And I guess some people are just sort of wanting to know what are some of the some of the knowledge around disposal of bodies and storage of body. I mean, it sounds all a bit morbid, but that's our conversation today. We have to deal with some of the realities of death.
Yes, yes. You can look in very practical terms. The body needs to be stored. New South Wales Health asks that the body is stored in a refrigerated facility between 0 and 5 degrees. And we monitor those very carefully. Every funeral director does. But you can have your loved one at home on a cool plate. That is permitted. Yeah.
Yes, and you mentioned that in your, I think we talked about that when you're doing a presentation. I never knew that, so I think that's a really important piece of information. We've had some questions about where people can buy coffins from, and we'll try, we can sort of answer everything this morning, but everyone's got all sorts of interesting questions about coffins and where you can get them and what sort of how much we should spend, and a few questions also about a lot of funerals are sold as packages without a lot of clarity about actually what you're paying for.
Okay, if my advice around coffins is Google it, have a look. You can buy some amazing, beautifully designed cardboard coffins now. There's a lovely company down in Tasmania makes some beautiful ones. And you can ask your funeral director to do the same thing. You can do that with them and find one that's suitable. And there are numerous choices out there, and investigate that and the costs involved in that, and find what you're happy with. I just want to mention in terms of planning, when it comes to engaging a funeral director and you're making a decision about who your executor is going to be careful. And just as Suzanne has mentioned, choose the person that's going to honour you, and choose carefully. Better to have just one. And the reason I say this is that, we've met with families on occasion where two executors have both got equal legal rights and they can't agree. And so there's a delay with the funeral because then it becomes messy. So be careful and choose the person that is going to honour you and everybody in the process. Yeah.
Yes, again, we've heard that message a lot this morning, and it's good to restate it. Leanne, we know that tender funerals were established to answer some of the concerns that we've spoken about this morning, but they're not everywhere. And I guess we've got people from all over New South Wales here with us today.
Yeah.
So how can you make sure that you're getting the funeral that you and your loved one wants, not the one the funeral director wants to give you?
Okay, so the first way to do that is have these discussions. Know what's really important for you, and that it doesn't need to be a grand event. It can be really simple as planting a tree together and sitting around that tree and sharing memories of the person. That's an adequate funeral. Ideally, we were talking about this actually in a staff meeting about how wonderful it would be if a family came in and said, right, we will come in and dress and wash our loved one and coffin them here in your mortuary. We'll hire your van and we're going to do everything else ourselves. Fantastic. That's really our goal, is to see that develop. We're not there yet, but we are progressing greatly, and it's wonderful to hear and see that and hear how we can hold space with people rather than for people. There's a difference in how they move forward. Yeah, and to know that there's no right or wrong. There was a family years ago I looked after who didn't have a ritual for their mum. It was a simple cremation, which is fine. However, when their dad's time came around, they wanted a funeral. And I asked, you haven't had a funeral for your mum? And they said, well, no, Dad was too distressed and we thought we'd spare him the distress, and we didn't have that. And I thought about it over the weekend and I went back to them because it felt unfinished. And I said, I thought, what, I bet they've got her ashes somewhere and they've done nothing with them because it's too hard. So I said, how about if you have the ashes, bring them along, we'll put them on your dad's coffin and a photograph of your mum and dad. And let's have, I get really moved talking about this. This is why I love what I do. And we'll have a funeral for both of them. And they said, yes, great. So we did that. And independently, the two, the son and daughter, after the funeral, about 10 days or so, rang me and said, thank you. We didn't know that we needed to say goodbye to our mum. So there's no right or wrong, but it's important.
No, Leanne, and those people will be forever grateful to you because that's so important in terms of their own grieving processes to make sure that they've done the best goodbye that they can. And we all make assumptions about these things, but it's important to have people like you around and people like Suzanne. I think you've really helped us understand death and dying in ways that I'm sure all of us out here didn't quite know. We didn't want to have those conversations. Today, I hope everyone goes away and starts the conversation to make sure that we all honour the people that we love in death. Susan, we're going to finish with a money issue as to get into the realities of life. Some of the people that we interviewed, they talked about funeral insurance, prepaying for a funeral. Is there a safe way to do this ahead of time? And before you answer, I just want to say to everyone that's with us today, we're just going to go for 5 more minutes and we'll finish about 12:05. Over to you, Susan.
And I'll be quick. The short answer is get good advice. Jump onto the government Money Smart website. The Tender Funerals website has some really good information. Your own financial planner, please get good advice. Secondly, in terms of paid funerals, there's a few things you can look out for. Is it a registered fund? Review payment options carefully and find out whether you can get out everything that you put in, and what are your options for exiting the fund if you change your mind or whatever. You can certainly get insurance, but again, premiums can go up, and what you want to be sure of is that you will not be paying more than the cost of your funeral in premiums. So you need to check that. For families who are experiencing hardship, there is going to be a new product coming onto the market soon, which will underwrite any gap in a savings plan to make sure that a family has access to the funeral that is right for them. And there are other ways at short notice of getting support from charities and through no interest loan facilities. There's plenty of information, and as I say, those 2 websites, I'd suggest the Tender Funeral website is great, but the Government Money Smart website, but there's no substitute for getting proper advice. Joan.
Great. Thank you, Susan. Well, we're getting close to the end, and I haven't asked the panellists in our preparation for the webinar today to do this, so I'm going to put them on the spot, and I would just like each of our panellists to leave us with one passing message that you don't want us to forget. Give you a couple of minutes to think about that. Okay, Suzanne, can we start with you?
Planning and timing is everything, and try not to leave everything to the last minute. It's simple, but try and plan and prepare best you can. And the other point is have a backup plan, have a plan B, have a plan C. Things like COVID have thrown us into disarray, so we've all had to do plan Bs with many things. So plan and prepare, but have a backup as well.
Thank you. Leanne?
Yes, my message would be take your time. Please, take your time. Slow down, consider your options, talk to each other, and know that there is no right way forward other than what you need to do.
Thank you very much. Susan?
My message is that there's no bad conversation about dying and death. Conversations about dying and death are conversations about life. And we all need more good quality conversations about life.
Yes, we sure do. Stephen? Thank you. Is Stephen still with us?
Take the responsibility yourselves for your own decisions. Take your decisions to your GP and present those to your GP to be countersigned. Have the conversation before you go. Compassion is empathy and action.
Wonderful. Well, we could write that into this webinar's manifesto. I think those key messages would make a great manifesto. So folks, that brings us to the end of today's webinar. I thank you so much for joining us, and I hope you've already started to think about some action and some ideas from our speakers today. Even though we want to encourage everyone to talk more about death and dying, as we've all said this morning, it's a very, very emotional process. If this was a face-to-face event, we'd all have a cup of tea together and we'd have a chat, and I'd probably give many of people a cuddle. People know I'm a touchy-feely person, so I'd probably have a hug, but we can't do that. So I want you to please take some time to have a cup of tea with someone, go for a quiet walk, listen to some music and do some quiet thinking. I'd like to thank our guest speakers and event partners today. Suzanne, thank you so much. Leanne, thank you, thank you. Susan, thanks. And Stephen, my colleague, a big, big thank you. Just to let people know in finishing, in terms of how this information is going to get out there, there will be an email going to all of you tomorrow, and this will include some extra information and resources that we've talked about today. There'll be lots of links. We'll also have a link to the COTA New South Wales YouTube channel. So we told you we're recording this. So that will be available, I think, tomorrow. And then you can share that with your family and friends to get the conversation going with even more people. If you need any of those legal planning documents prepared, I mentioned to you that COTA New South Wales has a legal pathways program that can assist people. We'll have that information out to you, and we only charge $50 for each document. So it's a really worthwhile, essential service, and it's very cost effective if you do it through us. COTA New South Wales has a regular series of webinars. The next one is about health and wellbeing as you age, another important conversation. So watch out for the invitation and have a look on our website for more information. And you can always catch up, as I said, on our earlier webinars on our, isn't it fantastic, COTA New South Wales YouTube channel. I think it's a great initiative. Remember that we have a band of volunteers here at COTA called community speakers, and they can come and speak to your group on a range of topics, including death literacy, which we've talked a lot about this morning. So check out our website for more details and give us a call. Again, thank you so much for joining us. Take good care. Keep those conversations going. And on behalf of everyone out there that I can't see, I thank our speakers today. Thank you so much. Bye, everyone.